I'm Dr Zac. I graduated from Adelaide University Medical School in 1987 and did a lot of training in various areas before I settled into general practice. And those areas include surgery, orthopaedic surgery, obstetrics and gynecology, emergency medicine, ICU, coronary care. So I did a lot of rotations before I went into general practice. Essentially, whatever training you have equips you with a range of tools. And then you find that there's jobs that you want to do, but you don't have the tools. So you need to look outside of the toolbox that you have and try to find ways of solving problems that your existing toolbox doesn't have. So in spite of all that other training before I started in general practice, I still realised that there were many problems that I had no solutions for. There were many side effects of medications that I didn't know how to help people with. And so I looked down the path of nutritional and environmental medicine, because at the end of the day, we are the product of our environment and what we eat. So I think it's really important to understand what causes disease, and that is a product of genetics and a product of environment and diet. And so modifying those modifiable factors gives us a chance to actually address the root of disease. And then I looked at nutritional and environmental supplements, minerals, vitamins, herbs, all of which have their place. But to me, I quickly realized that these were just alternative paint palettes in a paint by numbers system. I could choose the allopathic pharmaceutical palette and use those colors, or I could choose the herbal palette and use that, or I could choose the vitamins and mineral palette, but none of them addressed everything. And so it became a realization that you have to tailor to the individual. So there is no magic about herbal medicine, homeopathy, allopathic medicine, nutritional medicine. What I believe is that there are tools within every one of those modalities, and we need to select from those different modalities to solve a problem for a particular individual. What's right for this person with this particular condition? I've got another patient with exactly the same condition, but that same approach won't work. So I have to tailor to that individual. And so to me, it has always been a journey to solve problems that my existing toolbox doesn't solve. In the early 90s, I studied herbal medicine. And again, it solved some problems, but still didn't solve a lot of other problems. So I became very interested in what makes herbal medicine work. It's been traditionally practiced in every culture in the world. About 5 years ago, cannabis became legal to prescribe. I, to this day, have never smoked a cigarette. I didn't touch alcohol until I was in my 30s. And I was very much brought up against cannabis, that it was a danger drug. But once it became available for prescription, I decided I better investigate this plant a lot more, and found that it was far more complex and had far wider applications than any of the herbs that I had become familiar with and had been prescribing. I realized that it wasn't about one plant, it wasn't about one chemical within the plant, and that each strain of plant had potentially many applications, but different applications. And so we could now tailor to the individual a lot better than what we'd been able to do previously. I can't believe we should be without an intensive care unit, a trauma unit, ambulances, orthopaedic surgery, eye surgery, cataract surgery, etc. That is part and parcel. I mean, we can't just go and abolish triple bypasses because, yeah, let's try a herb or let's try a supplement. I think that's very naive to say that modern medicine shouldn't be the mainstay of treatment, but there are gaps, and those gaps we need to fill with other complementary approaches that will provide a better quality of life. At the end of the day, it's not just about fixing an immediate problem, but creating an environment within your body of health. I think people are searching for answers to problems that are not being solved or addressed by the care that they're having. They wouldn't be seeing me if what they were currently doing was working perfectly well. So they are looking to either improve an outcome, or they're unhappy with a side effect and they want to explore options. So it's not about making recommendations, it's about exploring options, giving people choices, and giving them information on which they can then go away, do some further research, and choose other options that may help or may reduce side effects. And it may be as simple as just some lifestyle changes, not necessarily a prescription or a recommendation for a product. It may just be as simple as lifestyle. We don't want to get into this idea of competing prescriptions. It's not either this or that. It's not either herbs or prescriptions. It's part of a bigger picture. It's putting it all together. I don't choose peas or potatoes. I'm allowed to have both on my plate. So, it's that engagement with the consumer, finding out what they want, what are the problems that haven't been addressed with their current treatment protocols, and how can we assist in finding more suitable options for that client. So it's bespoke medicine, it's custom made. It's not about having a one size fits all. And one of our issues with cannabis is that, traditionally, when I was growing up, it was all weed, it was all the same thing, and it was all about just getting stoned. It's a far more complex plant. An orange is far more than a vitamin C tablet. It's a complex. A wine is far more than ethanol. We don't sack all the wine judges, extract the ethanol out of wines, and just have ethanol drinks in blackcurrant juice and call it a wine. There is a sophistication, and it's all about the terpenes, the smells, the flavors. What are the terpenes? Well, terpenes are around us all the time, every day. We as humans are programmed genetically to respond to smells and flavors. Walking through a pine forest relaxes you, opens up your airways. Why? Because there are plant factors, they're called terpenes, alpha pinene, beta pinene in a forest, which can help with asthma, opens up your airways, makes you relaxed. Walking through a lavender field makes you feel relaxed. Walking through chamomile makes you feel relaxed. Smelling some grated lemon zest makes you feel uplifted. These are all terpenes. We're programmed for that. You don't have to drink a cup of coffee to get a benefit from smelling the brew. That activates certain things in the brain, dopamine, which makes you happy just smelling the coffee. So it is not just about THC when it comes to cannabis. It's about that experience. But what about these terpenes? Well, the first major terpene that evaporates is humulene. Now, we've all heard of hops. We make beer out of it. It's really relaxing. You can have hops tea. Hops has been used traditionally to treat epilepsy in traditional Western medicine. Hops, the main terpene is humulene. It evaporates at a temperature of 109 degrees. So when you burn your cannabis, you have destroyed the humulene. One of the major relaxers in the plant, you've just destroyed it. The next major terpene that evaporates is linalool. Linalool is the major terpene in lavender. We know that that's relaxing, an antidepressant effect, and has some muscle spasm relieving effects. That evaporates at 130. So when you're smoking, you've lost that one as well. And if you're vaping at 200 degrees or 180 degrees, you've missed that as well. So start low, heat slow. What's another major terpene? Well, beta-caryophyllene. Beta-caryophyllene is found in rosemary, black pepper, cloves. It's a major anti-inflammatory. We've all probably as kids used some oil of cloves for a toothache. It numbs the toothache, it relieves the inflammation. It evaporates at 157 degrees. Again, you're missing out when you're smoking. What's the next major one? Another relaxing terpene, myrcene. Myrcene is found in mango. Myrcene is very relaxing, happy, mood elevating. 176 is the evaporation point. Again, if you're burning your cannabis, you've just missed out on yet another major terpene. Pinene, as I mentioned in earlier, is what you find in pine forests. That helps with breathing, it's relaxing. Eucalyptol is an antibacterial found in eucalypt trees, eucalypt forests. When you walk in the eucalypt forest, you are getting some antibacterial effect for your sinuses, your airways, your lungs. Again, different cannabis plants may have eucalyptol in the plant, can be very beneficial. Selecting the right plant for what you need may be really beneficial. And one of the interesting things about cannabis is that the standard picture is you got to burn this to get any benefit. Hang on, at room temperature you can smell the cannabis. And if you bring it up to your nose and have a good smell, it is doing something for you. Those different smells, those different flavors from the different strains and cultivars have a different effect on you at room temperature. You don't have to incinerate it to get a benefit. You don't have to burn your steak to make it taste better. You don't burn your toast to make it taste better. Why on earth have we got this picture in our mind that the only way to use cannabis is to incinerate it? I mean, it's so disrespectful, and we are missing out on so much of the benefit of the plant. What is aromatherapy? Well, we have aromatherapy around us every day. Every time you walk into the garden or smell somebody cooking in the kitchen, you are experiencing aromatherapy, and it has activating effects on different parts of your brain. Cannabis does the same, and there are thousands of cultivars, all of which have different effects on our brain. But when we burn it, we destroy all of those differentiating features, and we imbibe smoke and THC so you can get stoned. Well, that is not a medical approach to cannabis. To me, it's all about getting the benefit out of that plant. We have terpenes in cannabis. If you light the cannabis, those terpenes evaporate pretty much instantly. They go into the air around you. So if you are smoking cannabis outside, you literally miss out on all of those terpenes. And it wouldn't matter what strain of cannabis you are smoking, because you're losing those differentiating factors. They are going up in smoke. You're missing out, you're getting smoke, you're getting THC. You may get stoned, but you're not going to get a lot of medical benefit out of that. So why vape? Well, vaping is simply slow heating, reaching different temperature points at which different terpenes evaporate. So of course, everybody's seen people smoke it because that's the way we've always seen it done. But we don't need to do that. We can actually heat that plant slowly. I gave the example that it puts a smile on your face when you smell it at room temperature at say 25 degrees. So what happens when you heat it up to 60 degrees. You're warming up those terpenes. It's like having a little tea candle aromatherapy, and you're evaporating some of those terpenes into the room and getting more benefit just by gently heating it. Now at 60 degrees, you're not accessing THC, but you are accessing some of those terpenes which may be anti-inflammatory, or they may be mood elevating, or they may be relaxing. So gradually heat it. The combustion temperature of cannabis, the point at which it burns, a properly dried bud will burn at approximately 236 degrees centigrade. There has been a big fear instilled in the population about vaporizing because it's a current fad. Teenagers, young people love to vape. They walk around with these machines that are blowing out clouds of vapor, and various different chemicals, many of which do not exist in nature, have been added to these vapes for flavor, and we have no idea how these different chemicals may affect the lungs. We are surrounded by terpenes and vapes in nature. We inhale smells every day. There are no known side effects of people working in a lavender field or working in a rose garden and inhaling or vaping rose smells. There is plenty of evidence that living in a house with multiple open fires will lead to lung damage. Having a potbelly stove is far more dangerous than smelling roses. And so when we're vaporizing cannabis, we're not talking about smoke. Smoke is the byproduct of combustion. Combustion is when you overheat something and you burn it, you incinerate it. Vaporizing cannabis is simply heating gently to release those beneficial terpenes and those chemicals which may have a positive beneficial effect without filling the lungs up with smoke. So when we're talking about vapor in cannabis and dry herb vaporizing, I consider it as safe as walking through the forest and breathing in alpha pinene, beta pinene, or walking through a eucalyptus forest and breathing in eucalyptol. I'm not aware of anybody having side effects from having Vicks VapoRub, and that is certainly inhaling terpenes. So the higher the temperature, you will start creating smoke in your vaporizer. As you get closer to 200 degrees, once you've got over 180, there is smoke being created. Much less than if you're incinerating the plant, but certainly there is smoke being created at those higher temperatures. If there's no smoke, you're not inhaling particles. Now here's another really interesting concept, because if you are seeing smoke, you are probably inhaling smoke. So that is putting particles of carbon into your lungs, which we know can have significant long-term complications of scarring of the lungs, emphysema, etc. So far, there have been no reports of cannabis causing lung cancer, but it is known to cause other lung diseases. So there's this thought that you can't use cannabis if you have asthma. Wrong. You can vaporize cannabis and get the benefits of the terpenes, which will actually help your lungs. The beta-caryophyllene can be anti-inflammatory. The myrcene can be relaxing for your airways. The pinenes can open up your airways and you breathe better. So asthma is not a contraindication to using cannabis if you use it properly. When you are inhaling smoke, it's not all going into your lungs. Some of it is touching the insides of your mouth. And then the saliva is washing that into your stomach. You are then absorbing some of that through your liver. And so you are then going to absorb into your liver some of that THC. Now, what happens in the liver is that the THC gets converted to 11-hydroxy-THC, and 11-hydroxy-THC is very psychoactive. It can cause the paranoia, it can cause the anxiety, it can cause hallucinations, and that's where the potential side effects of cannabis come in, mainly from the ingestion and conversion to 11-hydroxy-THC. So when you're inhaling dry herb and you keep the temperature low to a point where you're not creating particles of cannabis and carbon, and you're not swallowing that, you may not have any psychoactive side effects. And you may not be excreting THC in your saliva. But I can't guarantee that, because that is, again, genetically determined. It varies from person to person. So there are no hard and fast rules. These are rules that are individual to an individual person. And so we can't give you a guarantee that you're not going to test positive on a roadside test because you've inhaled at 170 degrees, because we don't know the specific genetics of your liver. We talk about the two main components of cannabis, and everybody's heard of THC, and you've got CBD, but they are only two of over 500 plus known components of a cannabis plant. And it's all about that symphony orchestra effect. It's not about that piccolo solo. It's about that experience, that symphony all coming together, and all those different components of the plant working together to achieve a balanced result. And when we balanced CBD with THC, we minimize the side effects of THC. You're far less likely to experience side effects of hallucinations or feeling disengaged if you combine CBD. And then there are other minor cannabinoids, CBG, CBC, both of which are highly anti-inflammatory and not psychoactive. You've got CBN, which is a really good sedative. Again, it is minimally psychoactive, and you can drive legally with using CBN as a sedative because it isn't considered psychoactive. So selecting those different products to solve a particular problem. I have a patient who this week I spoke with that was getting no effect from oral cannabis. He does get a benefit from inhaled cannabis, but he gets no effect from oral THC. And I gave him a product that was a balance of CBD and THC in a ratio of 30 milligrams per mil of each product. Per mil. He took 1 mil, it did nothing. He took 1.5 mils, it did nothing. He took 3 mils, it did nothing. He then took 5 mils, which is 150 milligrams of THC. Now, any normal person would be seriously stoned. This man had no effect, but on a small amount of inhaled cannabis, he does get a benefit. In other words, this gentleman does not have the liver enzymes to convert THC to 11-hydroxy-THC, and he gets no benefit from oral THC. And again, this is something that is unpredictable. We cannot understand the different genetic profiles of different humans, and so we generally start at a low dose, increase slowly. We can't guarantee that a particular product is going to have an effect because there are individual genetic variances. Because your oral consumption of cannabis converts to the more psychoactive form, there is a much higher likelihood that you will potentially get the psychoactive side effects. Now, people say, oh, well, THC, it stinks. No, it doesn't. THC has no taste and no smell at all. What you smell in cannabis is the terpenes. THC, when people put it in cookies or cupcakes or brownies, has no taste and no smell. You don't know that you've had any until 20 or 30 minutes later when you are feeling the psychoactive side effects of that THC being converted by your liver into 11-hydroxy-THC, and you're starting to get the woozy head, the stoned or the high response. But you had no idea that you'd consumed it because it has no taste and no smell. THC. CBD does have a taste. It's quite bitter. I've had people tell me that it tastes like oven cleaner. It's really hard to mask it in an oil. It's really hard to mask it in edibles because it is bitter. But it is very minimally psychoactive. In fact, it is more calming than anything else. There are many components to the plant. I like to think about a holistic approach to the plant. Like I think about a car. If I want to move a car, it's pretty important I have an engine. Otherwise it doesn't move. Well, the engine in cannabis is THC. That's the driver. If you've got severe pain, nerve pain, crushed nerves, you need an anesthetic, not an analgesic. If you've got crushed nerves, morphine won't help, pethidine won't help, tramadol won't help, Norspan won't help, Panadol won't help, anti-inflammatories won't help. You need an anesthetic. That's why you have a cortisone anesthetic block or you have a general anesthetic. How much morphine would it take for me to cut out a skin cancer off your arm without an anesthetic? How many times has a chemist asked you to take some Panadol? I'm about to drill your tooth and pull it out. No, they give you an anesthetic. Well, if I've got a broken bone and I start jiggling the fracture, it's going to be excruciating pain. That's why we put it in plaster. But the moment you move it, it's going to be painful regardless of how many painkillers you've consumed. That's not very different to having a badly arthritic knee or a badly arthritic hip. It's bone on bone. It's rough. Every time you move, it's painful. And the painkillers are not helping unless you're not moving. But when you move, you're in pain. Well, THC may be the answer because it does provide a disconnecting effect. It is an anesthetic. So it disconnects you. Look at somebody who's really stoned. They are totally disconnected. But in small doses, we can treat nerve pain and other strong pains that may not respond to narcotics. Understanding the difference between an analgesic and an anesthetic is really important, and cannabis provides us answers to some of those things that narcotics have never been able to solve. So there's a potential use for THC. However, some people won't tolerate it. They won't tolerate the dizzy head, the dry mouth, the blurred vision, the paranoia. How do we address that? Well, fortunately, there is another component of cannabis called CBD, which modulates those side effects. It can reduce all of those side effects that I mentioned by reducing the side effects of the psychoactive side effects of THC. So by using the two products together, we may get an additional benefit. So, what are other entourage components? Those things that work together. You may have CBC and CBG. They are also anti-inflammatory. They are present in the cannabis plant in small amounts. But we can isolate them, concentrate them, and add them to a product where somebody may have a lot of inflammation. It may be autoimmune disease, it may be rheumatoid arthritis, but they have to drive to work every day. They may have to operate heavy machinery, and they can't have THC in their system because they may be affected by the THC. So we can produce products that are custom made, bespoke for the problem. We can have products that contain anti-inflammatory terpenes, minor anti-inflammatory cannabinoids. Add those with CBD, which is the major anti-inflammatory cannabinoid. Putting those things together, we can solve a lot of problems that I can't solve with allopathic medicine, and I can't necessarily solve with a simple off-the-shelf CBD isolate. It just doesn't work. So what role does CBD play if we're using the motor car analogy? It's the brakes. It stops the side effects of the THC. It stops cravings. It reduces the development of tolerance to THC. Tolerance is where you need more and more of a product to get the same effect, like we get with Valium and Panadeine Forte and caffeine. But that is tolerance. So CBD is the brakes on the motor car. It stops that development of tolerance. It stops and reduces the development of cravings. It may be beneficial in controlling addiction to sugar, coffee, Krispy Kremes, donuts, gambling. But you'll say gambling isn't a substance. No, but there is a part of our brain that is the addiction center of the brain. And addictive behaviors, such as gambling, may be helped by the use of a product like CBD, which reduces the development of cravings, reduces tolerance. I've had many patients completely give up smoking, have no side effects of nicotine withdrawal by switching to CBD, and immediately having no withdrawal effects from their nicotine. So CBD is an amazing product. It is the brakes, but on its own, in isolation, it may not achieve a lot, because having great brakes on your motor car without an engine doesn't make it move. So where does dry herb cannabis come in? Well, dry herb is how we can individually select which terpenes we're going to release at different temperatures. So if you go high, you can't go backwards. You can't unburn your toast. You can't unburn your $200 a kilo top quality Wagyu steak. If you've burnt it, you can't unburn it, but you can always heat it more and release more terpenes and get more benefit by starting low, heating slow. So selecting the right product is a bit of an art form, trying to find the product that solves the problem. So, people that smoke cannabis basically, and call it weed, it's all the same. Why? Because they are just distilling it down to THC. That's like distilling all alcoholic drinks down to, it's just all ethanol, it's all the same, it doesn't matter what I have, I just want to get drunk. Well, if you just want to get drunk, you're probably not going to spend $500 on a bottle of Grange. You certainly, if you do spend $500 on a bottle of Grange, you're probably not going to scull it. You're going to enjoy the terpenes, the aroma, the bouquet. You're going to swill it around. You're going to put your nose in the glass, and you're going to get the benefit of that full-bodied effect. And the cannabis is the same. Different strains will give you a different effect. So let's talk about the 4 components you need for a car to be functional. Really important to have a motor, otherwise it's not moving. Really important to have brakes so you can stop. But really important to have a steering wheel and a throttle. You need to control the power of that horsepower. So when you're consuming dry herb cannabis, the throttle is the temperature on your vaporizer. That gives you the intensity. It selects the steering. The steering is the terpenes. Is it going to be uplifting? Is it going to be pain relieving? Is it going to be relaxing? Or is it going to be putting me to sleep? All of those are important, and that's why the vaporizer is so important, because you select the temperature, you go through the temperature profile gradually, you absorb, inhale all of those beneficial terpenes one by one as they evaporate slowly, And if you need that strong anesthetic effect, you keep pushing it higher. So which of the THC subunits comes off first? Well, it's delta 9 THC. At about 157 degrees, you're starting to get some of those happy euphoric effects of the cannabis. Below that, you're really only getting the terpenes. So at 157, you're getting some of the delta 9, and then at about 175, 176, you're getting some of the delta 8, which is a little bit more psychoactive. And then you get all the way up to 220, you get the THCV. The THCV is the most psychoactive of all the THC subunits, and that's what people are looking for when they're smoking. They want to be stoned. The THC is the motor, the CBD is the brakes, the steering is your terpenes, and the throttle is your temperature control as you're heating it up. Now, obviously, some of that is not important when you're consuming it orally, because you don't have those temperature controls and you've got a fixed product within your oil, which you're going to ingest. Now, what's the difference between ingesting and inhaling? Well, everything that we ingest, all of our food, any medications, any alcohol, is processed by the liver. Everything that is absorbed from our gastrointestinal system goes through what we call the portal circulation. All of the blood flow, collecting blood and nutrients from the gastrointestinal tract, goes to the liver first. The liver makes up about 10% of our total circulation. So it will take multiple passes through the liver for the liver to clear what's in the general circulation. But everything that comes in through the mouth, through your gastrointestinal system, it all goes to the liver for that first filtering. And so any cannabis product that you consume orally will go to the liver and will potentially interact with foods, with alcohol, with other medications. Cannabis that is inhaled and the terpenes that are inhaled are going to have far less interaction because they are not competing for the liver metabolism. Think about a funnel. The more you put in the top doesn't make it come out any faster at the bottom. There is a limit to how much the liver can process at any one time. And so if the liver is processing a lot of chemicals, a lot of food products, the cannabis is going to sit around for longer. Cannabis also stores in the fatty tissues. So people who are overweight are going to store more THC in their system for a lot longer. You may test positive on a urine test or a blood test a lot longer than somebody who is ultra thin, who is not storing that THC. The THC metabolism in the liver is like the metabolism of alcohol and other medications. There are what we call fast metabolizers and slow metabolizers. So I can't tell a patient whether they're going to be a fast metabolizer or a slow metabolizer. How long is it going to last? Because that liver metabolism is genetically determined and is very individual from person to person. However, inhaled cannabis is far more reliable because it is not being processed by the liver. There is good evidence that high dose of THC can cause paranoia, can cause a psychosis. How does it happen? Well, it doesn't happen from CBD. It doesn't happen from the terpenes. It happens from unopposed use of THC. For example, smoking cannabis, destroying all those terpenes with a high temperature, having a plant with no CBD, and revving the motor full speed, high throttle, 236 degrees, just running that motor to capacity on THC alone. Of course, that is not a safe way to go and will put people at risk of psychosis. So as medical people prescribing cannabis, we are not recommending that people smoke. We're not trying to get people to use high-dose, unopposed THC. In fact, I think it's dangerous. We need to look at that plant holistically as a complete product. Going back to the orange scenario, we don't take the vitamin C out of an orange and feed you vitamin C and say, how did you enjoy your orange? We don't extract arsenic out of almonds and say, well, almonds are really dangerous because there's arsenic in them. You should never eat almonds. You could be poisoned. We haven't banned almonds. Why have we banned cannabis? Through inappropriate use by people who didn't understand the sophistication of the plant and all that it brings to the table. Take it as a package. I worked in a research facility researching medical products. I was personally involved in 10 different CBD trials, both internally and topically, for eczema, psoriasis, rheumatoid arthritis, acne. And the results? Purified CBD generally doesn't work any better than olive oil or any other oil. All oils are anti-inflammatory. CBD is little better than any of those, statistically insignificant. But you compress the plant with the CBD, you take the terpenes, you take the CBG, you take the CBC, you take that whole product and it works in concert. It's like that symphony orchestra and it works. This is a plant. Let's give it the respect that we give to other plants and not try and dumb it down to a single chemical molecule. Medication is a single chemical molecule. That's why we study it. That's why we do double-blind, placebo-controlled trials on a single chemical, and we then know how it works, but we then don't know how it's going to interact with cabanas and Kranskis and garlic and everything else that we eat and drink. Many medications interfere with what we eat every day. But we've studied a single chemical molecule. That's what pharmacology is. Let's not try to dumb down plants into pharmacology. Let's not try to find the holy grail like that is it. So how is Charlotte's Web strain different from Charlotte's Angel? It has a different terpene profile, it has a different cannabinoid profile, and Charlotte's Angel was shown to work for epilepsy in children. That particular package works, not the CBD. Let's say a patient comes in to see me with high blood pressure and 3 times in a row they've got elevated blood pressure. I need to start them on a medication. I've got a suite of 30 different drugs that I could try them on. Which one do I choose? Well, what side effects don't I want? Yes, some blood pressure medications cause constipation, some cause swollen ankles, some may cause a cough, some are not suitable if you've got kidney disease. So I've got to choose between different medications. They're all different. So I have seen many commercial products prescribed to patients, and in my early days in prescribing cannabis, it was very hit and miss, as I was a novice in the industry and I'd prescribe a product and wonder why it wasn't working. Because the manufacturer was unable and still is unable to give me a terpene profile on that particular product. Or I ask, what strain of cannabis are you using to produce your oil? Oh, we don't know. Oh, we know how much THC is in it. Okay, so I know how big the motor is, but I don't know if it steers left or right. I don't know whether it's going to make you anxious by accident or whether it's going to make you really sleepy when I'm trying to prescribe it to you in the morning for focus and, oh, oops, it made you sleepy because the label didn't reflect what I need to know to be a prescriber. I need to know what effect you're likely to experience and what side effects that particular product may have. Now, most of the commercially available products are not able to give me that level of detailed information. I don't want variable results. I don't want to try 5 or 6 different products before I get it right. I want to hit it 80-90% of the time on the first prescription. I don't prescribe based on product or diagnosis. I customize to the individual. Is this individual suffering from night terrors? Is this individual needing to drive her children to school every day? Every individual circumstance has to be taken into consideration to make sure I'm not putting both the individual, my patient, and the public at risk, and their family. So knowing a little bit about the social history of the patient, what brought them to this cannabis journey, what sort of traumas they went through their childhood with, what other medications they've tried, what other medications they're on, that's all part of doing a really good job and then getting that product right. It's not about, me trying to build an empire that everybody has to come to me. I want to make this accessible to more people by people who are passionate like I am. You need to be passionate about providing a service. This is not about providing a prescription. It's about providing an individual service to an individual with individual needs. We can train practitioners to that level of spend more time, ask more questions, formulate a treatment plan. Don't be in a hurry to reach for that prescription pad and just write the first thing that comes to your head. It's customizing, and by creating a group of like-minded practitioners, they don't need to be doctors to be passionate. They don't, palliative care services are mainly run by specialized nurse practitioners. Mental health is mainly run by specialized nurse practitioners in mental health because the psychiatrist can't get to everybody. So we are creating that same model that exists in the health and medical industry right now of creating a specialized group of team that works together to provide a service to the client that is customized to the client. And I can coordinate that. I can provide support to those practitioners to give greater access.